everybody. This is Stephanie Krubsak with the Purevant Living podcast, Women in Wellness. Here with me today, I have Dobelis Pohren, a MSN RN and founder and CEO of Integrative Family Medicine. Kara wore several medical hats since the start of her nursing career in 2008. She practiced in critical care, surgery, and operations management before starting IFM. Kara completed her undergraduate BSN degree at the University of Iowa, her master's MSN degree at Grand Canyon University, and is currently completing her nurse practitioner degree. Her own health journey led her to this place. After traditional medicine held no answers and she faced undiagnosed symptoms and ineffective treatments, she found her own answer in integrative medicine that included lifestyle changes and a multi-pronged approach to total healthcare that not only changes health but changes lives. After discovering the number of people who had stories similar to her own, she found herself in a unique position to do something about it. Not only did the integrative model open up treatment opportunities not available in traditional medicine, but it also allows her as a provider to become independent of healthcare systems that prioritize revenue over patient care. So thank you so much for being here with me today, Kara.
I'm so happy to be here. Thanks for having me.
So let's talk first about how we met.
Yeah. We met back in college, and I bet that has to be, almost 15 years since. And we were doing a college summer program that focused on leadership for high school students. And they would come to like a university in whatever city that we were in. In our case, it was in New York. And we worked on the medical program. So they came and they learned about leadership abilities and helped develop their leadership skills while also learning a little bit about the medical field.
Yeah, it was a really, really great summer. I know we worked at Fordham University, and I remember, working with the students and trips to Mount Sinai and different things like that. I think it was just a really, really cool opportunity, and I can't believe how long ago it really was.
I know. It kind of makes me laugh, like now that you're in like this holistic health journey. And I mean, you were wanting to go to the legal program to work with that one, and you ended up on the medical one, and just kind of how your path evolved from there.
Yeah, it is quite funny. I did go to law school immediately after that summer. So it was, kind of funny how it all works out.
Yes.
Tell us a little bit about, when you were, working then and you kind of started in the medical field and how you kind of moved into having your own company today.
Yeah, I think everybody's journey is so interesting because I started college and I knew I wanted to do something in the medical aspect. I did the summer externship that we were at, and it was medical focused, it was leadership based. I really liked that. I was finishing nursing school at that time, and when I finished nursing school at the University of Iowa, I went and moved to Arizona and worked at the Arizona Burn Center as a burn and trauma ICU nurse. And then moved back to Iowa, did some stuff. And the market wasn't really great because it was that 2009, 2010 recession era. And so I started travel nursing, and I started out in San Diego, California, and I just ended up never leaving San Diego for about 6 years. And I worked in critical care, surgical, trauma, ICU, transitioned into surgery. So I learned a lot physiologically about the body, but it was a really simple fix. Like it was really simple, like your appendix burst or you have appendicitis, let's go take your appendix out. But also a lot of the surgeries that we had to do they were considered elective, and but it was very clear that patient choices or their health journey could have been better before then. And as I really started to look into how conventional medicine worked outside of an operating room or outside of an intensive care unit, specifically the primary care model, like who you see for your regular care, I just really became fascinated with the process. And at the time, I was going through my own health journey, and I was traveling because that was one of the things I love to do. And I got sick. I was hiking in a rainforest in Costa Rica, And almost immediately after the hike was done, I started having, nausea, vomiting, all of these symptoms. By the time I got back to the States a couple of days later, I had this massive rash on my lower legs. And I went, I think, being young and mostly healthy at that time, I just brushed it off. I was like, well, I definitely was walking in a rainforest, so it would make sense that I have a rash. And I just kind of played off the rest of it. Well, 6 months later, I felt the after effects of what ended up to be Lyme's disease that was never diagnosed. And if you know one thing about Lyme's disease, it's you have to catch it in the initial incubation and prodromal period. You can't catch it 6 months later. But 6 months later, I was having these terrible facial reactions. My mouth and lips were swelling. I was horribly fatigued. It was just a miserable process. And I saw maybe 7 different specialists, including an infectious disease specialist that I would have thought would have caught, hey, we're hiking in a rainforest, it might be Lyme's disease. And I spent thousands and thousands of dollars. I actually maxed out my insurance plan that year when I got sick. So I had met the out of pocket deductible and the out of pocket max, and nobody had any answers. And then I found a functional medicine and integrative medicine doctor in San Diego. And her entire approach, she was a medical doctor that studied in India and came to the US and did her GI fellowship and then was practicing integrative medicine. Her entire approach was just so different. She looked at everything, and she really kind of came to the conclusion and helped me accept that it didn't matter whether or not we identified what happened to me like the 6 to 8 months prior. What mattered is how I rebuilt my health, and that this was going to be a journey. And she really had to help me shift my thinking. And so in that time period, I recovered really well with her. I had to do a ton of dietary changes, herbal tinctures. I did IV therapy and nutrition. Just really had to prioritize my health care. And in that time period, I moved back to Iowa, and there was nobody here for that. And so I spent 4 years in Iowa, mostly doing okay. I've worked with a nutritionist that did a lot for me in terms of supplementation, helping me manage some of my health, but it still wasn't great in terms of the number of resources that patients had. And what I realized is that a ton of people have gone through something like what I have gone through. They've gone through this terrible illness, and there's not really any answers because, for as smart as conventional medicine is, we still don't have the answers to everything. And what people are looking for is that integrative and holistic approach. So, my business partner and I were working in a corporate setting back in 2019, 2020, and we both left in February of 2020. And a month later, I mean, we hadn't ever talked about this together about developing our business idea, but we just sat there over coffee and talked about what the medical community in our city needed. And it was something like our practice. And so we developed that idea in March of 2020, and we opened on November 2nd of 2020. So it was about an 8 to 9 month turnaround, and we're off and rolling. We're starting month 4, and it's been just a fantastic launch since we developed the idea.
That is such a very great story. Your whole process of going through that experience with Lyme's disease in Costa Rica is quite crazy that they never kind of found the source of it initially. But and that you took the time to kind of fulfill a need in your city. So that's
Mm-hmm.
super great. And so new too that you just started like in the middle of a pandemic is a whole nother factor too.
Yeah, I mean, it definitely wasn't on my planned like agenda for 2020 to open a healthcare business in the middle of a pandemic. But here we are, and that's what we've done.
Yeah. I mean, that's and you said that it's been like super busy and going very well because if people are starting to realize that there's alternative ways of healing and if it's not in your city, that's great that you've kind of brought it to the Midwest in a sense. Because I am here in Wisconsin and it's definitely, kind of speeding up in that sense that more people are aware of it, but it's still pretty new, I think.
It is. And what it is, there's like some leadership and business philosophies for anybody who's a business owner. Um, there's what they call the red ocean, blue ocean strategy. And the red ocean is what already exists, right? Like regular primary healthcare models in your corporate settings. And what we did is we created a blue ocean. So we created a competition in a sense that we're trying to change a mindset, but we're not competing with the type of business that everybody in the red ocean is competing for. Like they're begging for new patients. They just want to click off volume, the number of patients that they see. But we're not doing that. I mean, it's primary care with a twist, essentially. It's holistic care. We're collaborating with the holistic and alternative community that already exists in our city. And we work with them because we really have this idea that you should come and see your doctor or your provider 4 times a year, and that will lead you to better health outcomes. It will lead you down that journey to health. And it's just a completely novel concept that you would go see your doctor 4 times a year while you're healthy. I mean, I've never really done that. So I think it's shifting a mindset from selling sick care, which is what the red ocean is doing, to selling well and healthy care, which is what we're doing as like a blue ocean business outside of what already exists in our city.
Yeah, that makes a lot of sense because you could outwardly, seem healthy, feel healthy, but maybe you're lacking on vitamins, which down the road, maybe a year later, could affect you. So I think that's a really great concept just to make people aware of that.
Absolutely. And one simple example is we do a lot with nutrition and supplementation on top of conventional medicine. And vitamin D levels are all throughout the literature and the research about how higher vitamin D levels have better outcomes with COVID, even that the higher your vitamin D level is, the lower your risk of complications for COVID. Well, the medical literature also only accepts an adequate vitamin D level around 30. But also, the literature says that people have best outcomes when their vitamin D level is at like a 50 or 60. And so what's hard is that in regular conventional medicine, you may get that checked once. They'll see that your level is adequate at 30, but even though it's at 30 and what's an acceptable level for that lab report is not really what's acceptable for your health and your overall symptomatology at that time. And so that's what you get here. So we may get a regular lab level that says, yeah, your vitamin D is fine, but we also know we'd like it to be higher. And here's all the things that we can do in order to boost your vitamin D. And that's really like kind of the difference in experience that we have here at our practice.
I have heard that before about vitamin D and actually how beneficial it is for your immunity. I guess one thing too maybe might be interesting for listeners. If, like, for example, we're in the Midwest, we tend not to have as much sunshine as other areas. Do
Mhm.
your vitamin D levels drop very quickly because of that, for example?
Yes, especially in the Midwest with the winter. And vitamin D, not just with your immune system as we're talking through a pandemic and flu season, but also in the Midwest where seasonal affective disorder is a huge issue where we've got less light. I mean, it's dark at 4 p.m. starting in November. And just now, here as we hit February, we're starting to get a little bit more light each day. And that is also related to your vitamin D. So not only are you not getting as much sun, but that lack of sun drops your vitamin D level, which can also drop your mood. And what do most people do? They go into their doctor, they start on a prescriptive medication, which is fine. We do all of that here. But we're also going to turn around and say, hey, you need a little bit of help? Like, let's talk about all of our options. Like, do we need to get you on a medication? Let's talk about your sleep schedule. Let's talk about supplements that can boost your mood from the top of what we call the endocrine axis, the HPAT axis. Let's talk about your vitamin D levels or your B12 levels. And I don't think that you get that if you walked into your doctor's office normally and said, hey, I'm having low mood in the middle of January in a Midwest winter. They're just going to take out their prescription pad and write you for a new medication.
Yes, thank you for saying that because I think that is a huge thing that, it's like treating the symptoms, but it's not preventing it or it's not healing the body. So it's almost like a cover up, I think, sometimes. But yeah, no, I
Mm-hmm.
think that's great to suggest other alternatives that are natural and Yeah, like just like niacin, B3 is another mood booster naturally, things like
Mhm.
that. Um, so, kind of looking at some of the different services you have, and you covered a few. I was curious about the IV vitamin cocktails. You want to talk a little bit more about those?
Yeah. One of the things that we have here is the IV vitamin and nutrition therapy. And this is great whether it's for general wellness or for people who are recovering from post-viral illness like COVID. They're calling it long COVID now in the literature. If you've had it, there's acute COVID where we can use it to try and keep you out of the hospital. But then there's long COVID where people are still having these oxidative stress effects that affect their lungs and their immune system and their heart. So we're doing some nutrition with that. We've got people who've had Epstein-Barr virus or shingles or Lyme's disease or chronic fatigue. And so what we're able to do is a lot of these people, I mean, it really does start in the gut. I mean, I think you can probably find just about any person related to health and wellness and the importance of your gut. But what IV nutrition does is if your gut is struggling, because it will with any of these very stressful illnesses or conditions, is that you won't absorb any other supplement that you're taking. So you may have chronic fatigue, but your gut is out of whack. And if you're trying to take stuff for your fatigue, but your gut isn't working, you're really just wasting kind of your time and money on those things for the fatigue because your gut can't handle everything. And what IV nutrition does is it goes straight into your bloodstream. It bypasses the gut. It has 100% bioavailability to your cells. Your cells take up that great nutrition. And what they do is when they can suck up that good nutrition, they push out all the toxic waste that it's holding onto from the residual viral illness that you've had, whether it's Epstein-Barr or Lyme's disease. And one of the great things that we love to use in our IV nutrition is vitamin C. Vitamin C, again, IV is in the literature for cancer patients. It's the best way to explain it is when it gets into your body, it fizzles all of that toxic waste and oxidative stress out, just like hydrogen peroxide does on an open wound. Like it's literally just like fizzling it all up and getting rid of it. And vitamin C does so many things, right? Like it helps move that oxidative stress or the toxic waste out. Vitamin C is known to stimulate the adrenals, which are related to your fatigue. It helps boost your immune system just in general. And then we can use other things in there to help tailor whatever it is that you're needing in terms of what's going on with you personally. So we're just seeing people make leaps and bounds with using IV nutrition as an adjunct for some of their symptom management and treatment for some of these long term conditions and illnesses that they can't seem to get over with conventional medicine treatments.
That sounds like something really great to try. I guess I know it's probably different, for every patient, but is it something that you want to get done a few times a year, or what is like the most common form of getting these vitamin cocktails?
Yeah, it comes in different forms. So if you're pretty well and healthy, some people might do that every month. We have a few athletes that come into our office and they'll do like training or event competition, and they'll come in like a few days beforehand to get a good boost, and then they'll come in afterwards for a recovery. Um, there are people who we've seen that we're treating with active COVID. They've got a positive test within the last few days, and they're trying to stay out of the hospital. And so we use a lot of vitamin C and zinc because zinc helps stop that viral replication and the vitamin C helps rid that out of your body. So those people we maybe saw 2 to 3 times a week for a few weeks at a time. Some of these post-viral illnesses that are more of a chronic long-term that people have suffered with for months or even years, they take more of like a burst and taper effect. So the first week we'll do maybe 3, and then the second week we'll do 2, and then maybe the third week we'll see where we're at. Do we need to do 2, or then can we go to 1? And then we start as soon as your body has enough of that nutrition and has pushed the waste out, we can get onto a more regular schedule of weekly or every other week or even monthly. So it's always tailored to the patient. And that's one of our philosophies here is that we treat people, not conditions. So we go based off of what you need versus what maybe, conventional medicine should say about your condition.
Very interesting. I feel like I need to take a road trip to Iowa to give it a try. But no, it just sounds so healing, and I'm guessing that the vitamin cocktail is probably a lot faster working than, for example, taking vitamins, because bioavailability, for those of you listening, means like the amount of actual like vitamin your body can absorb. And I know sometimes like if you ingest it in your stomach, you may not get as large of a percentage versus your bloodstream or even like topical things. But are there anything that you'd recommend for listeners that they can do at home or over the counter things they can take too that are helpful?
Absolutely. We still recommend, even when you're taking the IV nutrition, that you're on some sort of supplementation. And we do this big 200 symptom survey. It has 200 questions, and you rate the severity of your symptoms. And we can actually calculate what what systems in your body are saying, hey, I need the most help. We're able to differentiate within your autonomic nervous system if your sympathetic versus parasympathetic system is more dominant than the other. So great things for people who are just in terms of immune health, since we're in the middle of a pandemic. Vitamin C is always great. There's some literature out there that you can find that the amount of vitamin C that you need to take orally is the amount that your gut can tolerate up until the point that you need to go number two. And so that's the point of tolerance. And so some people have that at 10 grams of vitamin C, and other people have that at 30 or 40 grams of vitamin C, which to me is a lot to take in a day. I mean, I just feel like that's taking, you know, 2 grams every hour to see how it affects me. But that's really one of the best ways to get vitamin C. And then zinc is always a good one right now in terms of immune health, because zinc helps ward off that viral process. And if the viral process does start within your body, it helps stop the active replication of the viral process. So those are kind of my two favorite ones that I recommend for immune health. And then actually vitamin D becomes so important, especially in the middle of a Midwest winter, in the middle of a pandemic. Um, I like vitamin D in the form of a fish oil. And in particular, my favorite one is cod liver oil because of the DHEA components and the vitamin D availability. So you're kind of getting a 2-for-1. We need those omegas, we need those good fats for brain health, but it's also giving you that immune system boost and helping you build your vitamin D. So those are usually my top three that I recommend. And then once we kind of get going on what people are struggling with individually, we have kind of some other things that we can recommend for people to take on a daily basis.
Thank you. That's all very, very helpful information because, yeah, it's hard to know what to take, right? You go to any store and there's hundreds of supplements or different types. Yeah, I know like vitamin D, you can get like the liquid form, you can take pills. So there's so many things. Also, too, I know I've been researching, this is more, I guess, along the lines of food, but even consuming different things together can increase the bioavailability. Like if you have like a carrier agent or fatty acids or oils that help your body absorb it better. Are there any other tips like that when individuals are consuming these vitamins that would help their body absorb them better?
Yeah, so not necessarily for vitamins themselves, but I always recommend to make sure that your fat ratios are appropriate when it comes to your nutrition. And that is in the form of like short term fatty acids, the medium chain, and the long chain fatty acids. And for people, like I say, the easiest way to do this is with olive oil, coconut oil, and grass fed butter. And those will hit all three of those. And having that regularly in your diet, one, the fat is not bad for you. It's not raising your cholesterol. The fat is actually helping you absorb a lot of that nutrition from the vegetables and fruits that you're eating. So I always start with like high quality fats and making sure that the short, medium, and long chain fatty acids are covered as the initial start to like your nutrition journey.
Yeah, that's great advice with yeah, consuming it with another kind of fatty product, or even I heard too that if you consume like seeds like hemp hearts or sunflower seeds with vegetables too, it helps your body kind of absorb those nutrients. So it's all interesting stuff. I know I was reading the book Eat for Life recently and kind of came across some of those things. But yeah, so with your business, are there any other? I know you kind of just begun a few months ago. But are there any other initiatives you're working on or other services that you're providing in the near future?
We're really passionate about just the health journey itself. One of the things that we'd like to get more involved with in the community is well woman health. And when you have a baby or you're a female, getting your yearly well woman exam is super important. But a lot of times you only see that provider and that specialty that one time each year. And this is so important even before you decide to have a child, because the nutrition of your body and how your body handles stress and exertion and fatigue is so important that one of my own personal philosophies in health is that healthy women make healthy babies. And so if we're talking about how we're going to change the health of the world, I really think it believes with like healthy women, because our genetics are set like 2 to 3 ancestors before us. And so we're already dealing with what they may have gone through. But if you're preparing and you're in your early 20s and you're like, yes, I'd like to have a child at some point in my adult life, we want to start talking about what that means. And I think there's just such a lack of focus on that in our healthcare and what it means to actually have your well woman exam, that we'd really like to start working on changing that perspective in the community, to see if it starts to impact things like birth outcomes or maternal health outcomes.
I think that's super important. And that's a great long term goal as far as it affects society. So I think that's really a unique perspective to look at it that way. Because you're right, a lot of people just kind of seek out those type of doctors and care like when it's needed, but not kind of really planning beforehand just to make sure that you're healthy before you have kids. Things like that is important, and like what you're eating, all of that. And I know you talked a bit earlier about your personal journey when you had Lyme's disease and how you basically kind of found holistic ways to treat that. How is that going for you today? And are you kind of doing a lot of like tune up things to manage that Lyme's?
Yeah, so I would say I pretty well had it managed by 2017, 2018, when I left San Diego and moved back to Iowa 4-ish years ago. I pretty well had it under control. But then, you have other stressors in your life that start to weaken your resilience to, your immune system, and it just gets overall kind of a little messy because you don't have anybody guiding that. So, um, and it's interesting because it kind of ties in with my whole philosophy of like healthy women make healthy babies. So, I became pregnant in 2018 with my first, and I mean, my body wasn't prepared. It was unexpected. So, as much as I say, hey, let's plan about your pregnancy and get you healthy beforehand, we still know that these things happen unexpectedly. But my body was in okay condition at that time. But of course, I had just a bruiser of a baby boy. I gained 70 pounds. My adrenals were thrown off. I was working in a high stress job. I only wanted to eat things that were spicy, and I had hot sauce. I barely remembered to take my prenatal. And I mean, my son, overall health wise, he's fine, but he's also super fussy about things. You can tell that the stress of my pregnancy has impacted a little bit about his personality and how he deals with things. Um, and so after him, I had terrible issues. I mean, one, you have to get all of that weight off of you because your body just feels differently gaining 70 pounds than before it was pregnant. I worked with a nutritionist friend. She really helped me kind of, I was probably 7 months postpartum. She really helped me with some of my postpartum depression issues. My overall body nutrition was just so low, the foundational nutrition that we need in order to just grow a baby in our bodies. And in that time of working with her, I got pregnant again. And so the difference that I say in when you can become healthy versus when you're not really planning or actively engaged in your health is that I didn't even know I was pregnant for like 4 weeks after it happened, because I had no symptoms like the last time I was on, because my gut health was so great. My adrenals were perked up. I was functioning so well. I was off all of my medications. I was eating well. And really, other than the fact that my firstborn still doesn't sleep, I have had like zero issues with this pregnancy because my health was so on par and really up to date and up to check, and eating right and getting the right nutrition, that this pregnancy has been completely different. So, I mean, I guess to answer your question, how's it going? I mean, it's just this journey. Health is this journey that we talk about with patients, and that you can really build yourself up, but then you can have a bad year like I did in 2018, 2019, on top of a pregnancy, and it can just really demolish a ton of the work that you've done. But if you have the right people in your community, your health is always reachable. It's there. You just sometimes need that support person who's going to do that, and that's really what we've been able to do, not just for myself, but for other women who are also on this journey, and men. I say women a lot because we see women, but we also see men as well.
No, I think that's a really great story and example just to kind of provide hope for anybody that, is going through something similar, whether they, have kids, want to have kids, they're in the process, or just want to better manage their health because, yeah, I mean, we all have our ups and downs, I think, too, and we can always, work to be healthier again, even if we have a setback. So I think that's, yeah, a really great story to share. And I hope it inspires listeners too.
Yeah, I hope so because sometimes I think people want to get a hold of maybe a health condition or an issue they're having, or they want to lose weight and they feel like they've got to go gung ho on this one program because it will fix everything about, you know, what it is that they're going through. And I really liken our health to this continuum of multiple aspects that we really have to have in balance. So you start spinning all of these plates, and the most you want, I mean, a plate could fall off entirely, like your physical health, or like you break a bone, you could have a mental health issue, you've got to have your nutrition in check. Um, and then spiritually, you also want to be in check. So I liken it to this continuum because the plates can be spinning perfectly, and then say you go out and you have a bad meal, which is totally acceptable, we all do it, but the plate starts to wobble, right? And so what we want your body to be able to do on this continuum is that one of your plates can wobble, but it gets itself back on track, and that even when one plate falls off, all of your other things are in check, that it's going to help carry you through getting that plate back on track and spinning again. And that's like the analogy I use with people all the time. It's not just one thing that you're doing. We have to get multiple things going. And it's hard with like the images we have in the media today and social media and the groups we're a part of, like on Facebook or Instagram. And there's a lot of shame involved if you're not doing things perfectly. But in reality, none of us are. I mean, I've eaten more donuts in this pregnancy than I probably have in my entire life. Like I've just completely fallen off the track with my nutrition, but everything else is so on point that I still feel okay and that I can get back on track even when I eat a donut, because that's clearly what this baby likes for this pregnancy.
That's great. Yeah, no, and I love your analogies too, just kind of putting things in perspective and realizing that it's okay to make a mistake and to, like I can eat better tomorrow, to have your cheat days or whatever. So I think that's really great.
Yeah, and part of it is just the awareness, right? It's when we make health changes or just changes to our life in general, is being aware of the pattern and even the mental pattern that we have associated with that. So eating is such a big one for people. We spend so much time on nutrition habits and dietary habits, and that this isn't just wiping out your pantry one day to go get everything gluten free and organic and whatnot. It's more than that. It's paying attention to what time of day you're eating, why you're eating, how you're eating. Um, can we hack a little bit of it, right? Can we create better habits by always drinking a glass of water before you eat a meal and then walking for 10 minutes afterwards? And some of these little hacks that we have help you get into better routines and better habits in general, that then help spiral you on that path to health.
Yeah, I think that's great advice because it's not easy to go cold turkey and just like you said, clear your pantry and oh, I'm going vegan tomorrow or whatever. It's a process, yeah. And if you start small, make a goal maybe every week to change something, so much easier. Otherwise, you're going to kind of fall off track and revert. So if you try to do too much at one time, so
Absolutely. And it's a health is just a big, daunting journey. And I mean, you can make leaps and strides week after week and see great progress month after month. But it's never just like, oh, I did a 3-month program with a practitioner and oh, I feel so much better. My health is, back to normal. That's never the case when it comes to health. Like it is a conscious decision day after day, month after month, that these are my healthy habits and this is what I need to stick to in order for my body to feel better. And I always think one of the beautiful things about this health journey is when people do eliminate a lot of those things from their life, they start to feel better because they aren't stressing them out anymore. There isn't that inflammation from food like dairy or wheat or things like that, or drinking alcohol. And they feel better. And then they go to a birthday party and they eat cake and ice cream and maybe have a few beverages and things like that. And they feel terrible. And the point isn't that you feel terrible and, that you fell off the wagon. The point is that we recognize how our body feels and that we're able to actually bounce back after that, because so many people will have that one instance and just continue to fall off the wagon and say, well, I did it one day. No, we want to get your body to the point where, yes, you recognize how you feel when you eat that way. It's totally okay if you have that craving and you want to cave into that, but let's get your body to a point where you can handle having those days. I mean, I know in exercise philosophy, they call them cheat days. We don't really call them cheat days. We just call them normal life. Like these normal things are there. I mean, I love cake. Like the donuts are there with this pregnancy, and they're probably, even once I have her, I'm going to want a donut because I'm so accustomed to that taste. So the point is to get to a point where I don't feel bad or feel shamed because I want to have that. The point is that the rest of my health is on track, that I can accommodate those variations in my lifestyle and still stay on track and still feel good about myself.
Yeah, it's definitely true how if you eat very cleanly and then you have something that's not in that category, that you do feel kind of off and not great. So I definitely can relate to that a lot.
For sure.
I know you kind of answered this as like we've been talking through everything, but what does wellness mean to you? It's kind of a vague question, but how would you answer that?
Oh gosh, I think it's wellness is really that cycle for me. So for me, wellness in particular means that I have to take care of myself before I can take care of my son, my husband, my family, my business. And I think it's so easy for people to get sidetracked and only focus on one thing. When you start a business, there's so much that goes into that. Well, that was fine for a few weeks as we were launching, but it really wreaked havoc on my health and wellness because I wasn't taking care of myself. So I have to be able to prioritize the way I eat, the way I sleep, the supplements that I take in order to feel really good about myself. And then the energy that I surround myself with, the spirituality aspect, all lead into my mental health component. And so when I take care of myself, I'm able to be well and healthy, and then I'm able to take care of the rest of the aspects of my life, like my family or my business or the patients that come into our office.
So, what is one wellness ritual that you do daily or weekly that kind of helps you follow that path and that you'd encourage listeners to try?
Sure. I think it's finding one thing that you are able to release some of all the clutter in your mind. And so a lot of people will say, oh, that's meditation or yoga for them. But for me, it's actually reading something that's not medical. So I need to get lost in a fiction book, like maybe a chapter or something like that, where I'm essentially giving my mind that, if you can't tell, is always working on overdrive to be healthy and to provide for our patients, for our family, for my business. I have to release myself from that. And meditation and sitting there for 15 minutes just does not work for me. So I have to almost reoccupy my mind with something like a fiction book in order to give myself that break.
I like that. I can relate as well. I have trouble sitting still, so meditation is not the easiest.
Absolutely.
Most definitely. So, for the fun question, what is your personal mantra or theme song that kind of gets you going, gets you in a good mindset, or kind of redirects your mind to a good place?
If you study a lot on like mental health or physical, like spiritual well-being and how it affects your physical well-being, I think some of it is in the daily affirmations of what we tell ourselves. And so for me, the things that kind of get me going are my daily affirmations that I am enough, like I am doing well, that I am happy, that I am loved, that I am accepted. Because I think with the society that we're in right now and the influence of social media, like it's easy to look at things that other people are doing and never feel like you're good enough. And so for me, it's that. And usually when I get ready in the morning, I listen to a podcast. And I can't tell you that I have a favorite one. It's just I'll listen to things that people recommend, or I'll pull up maybe one of the ones I regularly listen to, but it helps me just get in the mind frame for the day of being accepting. It gives me perspective when I listen to these podcasts for 30 to 45 minutes as I'm getting ready. Just really helps me set my day with the intention that I'm going to be open and receiving to whatever comes to me and that I'm able to handle it no matter what comes on my plate.
I know you mentioned some podcasts. If you want to share maybe what some of those are that you like or any books that you'd recommend.
Yeah. Um, I mean, podcasts are they're just kind of all over the place. It could be a podcast or a webinar. So I'm part of some business groups or some leadership groups, and they'll have like a YouTube session. So I'll pull up maybe the latest webinar. I love listening to NPR, kind of the daily 15-minute recap of what's going on in the world because watching the news or reading the news right now for me is really stressful. So getting it in like a 8 to 10 minute bite on those NPR daily news bits is about all I can handle. So those are kind of the like little things that I do, and I always recommend to people that you have to find what gets you going. Like if you can't handle the news, but you like the news, find a little snippet of something where you can get a recap of the day before. So that we're not perpetuating issues with our mental health or just our overall attitude for the day.
I would agree with that on the news. Maybe even using like BBC News or an app or something just to kind of scroll through and yeah, get like a high level overview. I think that's a really good suggestion.
Yeah, and I would guess if I have any suggestions for that, like one of them has been cutting out the news in my life. I certainly enjoy sitting down, maybe watching kind of like the NBC like nightly news if I have time, which I don't always have time to do. But I removed all the news apps on my phone. I removed the news button on Facebook so that I can't have that flooding, you know, my perspective and my line of sight that day as one of the inputs that you're constantly receiving. I mean, we talk about all these things that we deal with on a daily basis. How many emails do you read? How many times does your phone go off? How many times does my office phone ring or the office email go? And so having news that is super negative coming through my social media feeds, which I now have to monitor because I have social media business sites, I can't have that. So sometimes it's not always about what you add into your daily routine, it's about what you're removing as well.
Hmm. Great point. Yes, especially now. Yeah, when you have a business, social media page or pages, yeah, you can't just, not have it. So, although some days I wish that could be the case.
Yeah.
So, how can listeners reach you?
Sure. So our website is integrativemediowa.com. And on there, there's a booking link. You can contact us through our email, which is just info@integrativemediowa.com. You can find us on Facebook at Integrative Family Medicine of Iowa. Our handle on Facebook and Instagram is Integrative Med Iowa, just like our website is. So we respond to pretty much any of those avenues, and we're a small enough business where you're always getting me or my co-founder, Sarah. One of us is always usually replying to you.
Perfect. Well, thank you so much for your time today. And I will definitely have all of the links for your business on this episode. And thank you, everybody, for listening.
Thank you for having me.